Everyone, welcome to the review session. Please type your name and your email in the chat so I could take attendance. We will begin. It's Jeopardy style, so you could either shout it out or type it in the chat. So the first question is, how are proteins created? Translation is one of the ways. It's a many-step process. After you break it all down and they become amino acids, before that even happens, your DNA, the blueprint, it tells the mRNAs, and then the mRNA tells the ribosomes, and it occurs in the rough ER. And then the tRNA create polypeptide chains, and then there's the four different shapes of amino acids, and then it becomes functional. So if they're exported, they're packaged in the Golgi apparatus. So it's a long process, but eventually, when you consume a lot of protein, your body turns it into amino acids. So there's this misconception when you buy protein that it's only going to be like muscle, or if you buy collagen, that it's only going to be like for your skin. But our body is really good at breaking it all down to amino acids. And then this is the pathway for how our body determines what to do with that amino acid. So that's how they are created. Why does our bodies need protein? For growth and muscle, yeah, that is one thing. Um, Dr. Rose always says proteins do the work of the bodies. So they are the cell structures, they are the hormones, the enzymes, the muscle protein, and it yields 4 kcal per gram, similar to carbohydrates. And these are like more information of why our bodies need proteins. But basically, yeah, enzyme and hormone production, they do the work of the cells. What causes proteins to denature, and why is denaturing important? The pH change, yeah, using pH, heat, denaturing. Like, think about it this way: if you cook an egg for a very long time, it becomes like a rubbery texture, but you can't uncook an egg. So when you denature protein, like in the egg, it loses its function, which is good because when you eat like egg protein, you don't want it to still have the function of protein. And it's basically denaturing helps our body break it down. Yeah, it's important for digestion. Break it down so we could have the basic building blocks to use whatever we want to use it for. The examples of denaturing are heat, like you talked about, enzymes, acid, alkaline, which is pH, and agitation reduces biological activity. We don't want the egg protein to stay with the egg function. Yeah, you don't want them to work. That'd be kind of weird if you eat egg and it still is egg in your body. Okay, what are food protein allergies? Oh, oops. Can you list a few allergies? There's like 13 common allergens that are very common. Um, a lot of people are allergic to them. And they're basically proteins are immune system mistakes for harmful invaders. They see it in our body and they're just launching an attack to it, which can cause um, systematic problems. So for parents, when they have children, They introduced it at like 6 months of age. Like, yeah, eggs, peanuts, and milk are very common. If you see the nutrition facts on the back of packaging, they usually include these major allergens if they have it. So if you're allergic to any of these or your friends are, it's good to revisit those bold words. There's also sesame, seafood are common ones, wheat, soy. There's 13 of them. How does protein move substances across the plasma membrane? Facilitated diffusion is one way. They pump chemical ions in and out of cells, like in sodium potassium pumps. They move substances up their concentration gradient and help hydrophilic substances cross the plasma membrane. They are also called carrier proteins. Yeah, active transport. The sections on lipids. What are cis and trans fat? They are byproducts of hydrogenation. They're double bonds that have been straightened out. So cis fats is when the hydrogens face each other, and trans fat is the hydrogens are on opposite side chemically. So when you partially hydrogenation of the unsaturated fat, they have saturated fat properties, but they're not really saturated fat. Like if you go to a grocery store and you like buy like these semi-solid like fats and you read the back, they're usually like plant based oils, but since they've been hydrogenated, they have the semi-solid kind of like jelly texture in a way. It's kind of interesting. But however, trans fat have been banned in the US because our bodies cannot process it. So usually you'll see the cis fats in the store. What are signs of fatty acid deficiency? Hair loss. Yep. Dry skin. It involves the epithelial tissue because cells are rapidly turned over. Skin becomes flaky and itchy. Wound healing may be slow. You may experience diarrhea. Hair may fall out or lose its pigment. And you're more vulnerable to infections because, like, our skin cells are filled with a bunch of fatty acids. So if the layer isn't there, it's just like a broken shield. Growth may be restricted among children. However, in the US, fatty acid deficiency is not a really big problem compared to other health nutrition problems because lipids is one of the tastier macronutrients. So kids would eat fatty acids and not be deficient compared to other countries. What are chylomicrons and why are they important? They kind of sound like a transformer name. They're pretty cool. Microns are just like gnarly looking. I wish I had a picture of it. I always think about adding a picture to it because it looks kind of crazy. It's like a ball of massive triglycerides, dietary lipids, cholesterol, fat soluble vitamins packaged into lipoproteins. Yeah, they are large lipoproteins, they're pretty big. And they help transport lipids throughout our body because, as you know, lipids are hydrophobic. So if they're floating around randomly in our body, that's going to cause like blood clots and like other health problems. So these like lipoproteins, they collect all of these different kinds of fat and move them around our bloodstream. Um, and the question is, why does lipids spend so much energy breaking it down? Because as you remember, lipids as a molecule is huge. It has so many bonds. And as soon as they are broken down and go through the small intestines, they immediately form into these. It's because we don't want them floating around. What are the differences between low density lipoprotein, high density lipoprotein? Low density lipoprotein, it carries cholesterol made by the liver and from other sources to cells. And high density lipoprotein, it removes excess cholesterol from cells and tells the liver to stop producing cholesterol and excretes cholesterol from the body, which reduces risk of cardiovascular disease. So you could consume both of them. And if you eat a lot of LDLs, then you could have a buildup of cholesterol, which can increase risk of cardiovascular disease. While our body already makes it though, so it's kind of like one of those nutrients that if you don't eat a lot of it, you'll be fine. But the high density lipoprotein is the one that tells the liver to stop producing it if you have way too much in your cells. What are the differences between omega 3 and omega 6? Omega 3, it decreases blood clotting, while omega 6 increases blood clotting. And you need both of them. You might wonder like why? Why do you want to have our blood clotted? Well, if you get a wound, like an injury, like a scratch or something, and if you don't have enough omega 6, then you'll just like bleed out. And if you consume enough omega 6, then you'll clot and form that scab, which is what you want when you want to heal. However, if you consume a lot of omega 6, then it can cause random blood clotting in places you don't want to. So that's why eating like a mix of omega 3s and omega 6 is the best bet. And they come from different sources, but similar sources. Like omega 3 comes from fatty fish, canola, walnuts, flax seeds, mussels, crabs, shrimp, and soybean oil. Omega 6 comes from mostly vegetable oils, nuts, seeds, poultry. And they're both called a different number because of their chemical structure, the molecular structure. Omega 6 has two double bonds. So if you ever forget them, you can look at the molecule and understand. Okay, this section is on hormones, absorption, and digestion. What is cholecystokinin? What is CCK? Digestive hormone. It causes the pancreas to release pancreatic enzymes into duodenum to break down proteins into small peptides and amino acids for absorption. It also causes the gallbladder to release bile into the duodenum to break down fats. It also causes lipase to be secreted, which breaks down lipids, and it suppresses appetite. It works with leptin to regulate hunger, and it stimulates peristalsis, which is the movement of chyme through the GI tract. So it's a very important hormone. How are lipids digested and absorbed? So when you eat lipids, um, you digest it in the small intestines. The bile acid emulsifies the fat to increase surface area to let the pancreatic lipase get to lipid easier, so it's easier to digest. And then it goes through the small intestines as chylomicrons, and it's so big it can't follow the same pathways as carbohydrates and proteins. Like it can't really go through. So it enters the lacteals to the lymphatic system. And then through the lymphatic system, it travels through the bloodstream, and then it's dropped off and stored in adipose tissue until it is needed to be broken down. How is protein digested and absorbed? So we start from cooking it. Usually, cooking protein, it denatures it and makes it easier to be digested. Like back then, when people just ate everything raw, it took a lot more energy to break it down. So, cooking with fire and such, or like acids, like we talked about, heat, um, acids. And then when you're consuming it in your stomach, that is where the protein is started to get digested. It uses a lot of stomach acid, some pepsin and gastrin. And then in the small intestines, the cholecystokinin and trypsin are hormones that release a bunch of enzymes to break it down. And then the amino acid is enters through the microvilli surface. Like we talked about, the small intestines is aligned with a bunch of like folds that have a bunch of microvilli. So the tiny, tiny amino acids, the basic building blocks, go through it. And then since they're soluble in water, they don't need to like conglomerate or anything. They don't need to be repackaged, and they're actively absorbed through the cells. They travel through the portal vein through the liver. What are the functions of insulin and glucagon? They're called your fasting hormone and your fed hormone. Yep, insulin decreases blood glucose in your bloodstream. They both control blood sugar. Yes, those are the functions. Insulin lowers blood glucose level. Yep, those are all true. So insulin is called our fed state hormone because as you have fed yourself, it promotes fast glycogen storage. So it's quickly breaking down all of the glucose to turn into glycogen. And then in the cycle, I'll show you the cycle afterwards. And then when it's our body is like super low on blood glucose, glucagon is released, and it's called the fasting hormone because when it releases, all of the glycogen starts getting broken down and turned into glucose, and it raises blood glucose. So it's like positive feedback loop. And so when you eat, there's too much blood glucose in your blood, there's too much sugar in your blood. Insulin is released in the pancreas, and it promotes glucose to turn into glycogen for storage because glycogen it packs more tightly than glucose, so you can store it in your cells. And then glucose is also quickly transported into cells, so those are two pathways. And then once your blood glucose is stabilized, when it starts dipping, going down, it activates glucagon, which is another hormone, the fasting hormone. The pancreas releases it, and then it does the opposite effect of insulin. So glycogen is broken down into glucose and then gluconeogenesis. So that means you're creating glucose from a bunch of non-glucose things like from fats and proteins. It's pretty interesting. Okay. What are the differences between type 1 and type 2 diabetes? Here's a chart. Type 1 is could be summarized as there's no insulin, autoimmune, attached, and type 2, it just means there's some insulin. So type 1 is an autoimmune like problem. Since there's no insulin. And type 2, it means that there's some, you're just not producing enough of it to break down the glucose. So it's like a hormonal disorder. So type 1 is the left side, type 2 is the right side. And 5 to 10% of all cases of diabetes is type 1, while 90% is type 2. And their treatment is pretty similar. However, if it's not like managed, it could cause a lot of complications that are also very similar. And by monitoring the blood glucose, you could prevent those symptoms from occurring, those problems, health problems from occurring. It has sections on carbohydrates. What are the differences between glucose and glycogen? Glucose is the primary carbohydrate that our body uses to make energy, and glycogen is the primary form of carbohydrate storage in animals. Glucose is a simple sugar, glycogen is a complex carbohydrate. Yes, and plants don't store sugar like us as animals. They don't store it as glycogen. They could store it as a starch or they could store it as cellulose, which we can't break down. What is lactose intolerant? We can't break it down because we don't have the enzyme to do so. But they make really good insoluble fiber. Anyways, what is lactose intolerance? This is super different from a dairy allergy. If you're allergic to dairy, it means your body is launching an immune defense against the dairy proteins. But lactose intolerance is specifically with the sugar, with the carbohydrates. So, not enough lactase, the enzyme to digest lactose, which then the lactose moves to the large intestines and the bacteria there metabolizes it, causing gas, bloating, cramps, and diarrhea. Why do we need to consume complex carbs instead of just glucose or other monosaccharides? In other words, if you're a child and you asked your parents, why can't I have candy for dinner? What would you tell them? Well, why can't I just have candy, just candy on its own, nothing else? Because candy tastes good. You will tell them it's because simple carbs, like the candy you buy off the side of cashiers in the grocery store, they tend to have less bonds. So our body breaks them down really quickly and they're more readily available, which can be necessary in some scenarios, such as you need a brain boost when you're studying for an exam or in an exam. Like you just eat some candy and your brain will suddenly get the energy it needs to think. Or if you're running a marathon and you need something to give you some more energy to run, that simple sugar can help. However, on a day to day basis, some complex carbs with lots of bonds and chains, breaking it down, get over time, it creates more stable energy than a quick effect. So, like eating beans, which has high amylose, not effective if you need a sugar spike, versus short grain rice, which has high amylopectin, which means more sugar is released into the bloodstream because it has more bonds. Okay. What are the differences between sugar alcohols and artificial sweeteners? Sugar alcohols have calories. They're less than carbohydrates. They're 2.6 calories per gram. Artificial sweeteners don't have any calories. So consuming those don't really give you energy. They just taste sweet. What are the differences between soluble and insoluble fibers? Soluble fiber, it means that it's dissolvable in water, while insoluble means it's not dissolvable. Yeah. And because of that property, our body interacts with these fibers differently. Soluble, the one that dissolves in water, is highly like sought out from the bacteria in the large intestines or gut microbiota. And so there's if you eat a diversity of soluble fibers, like a bunch of fruits and vegetables, there's more diverse gut microbiota, which is linked to like more stronger immune system, having more like better bowel movements and like health in general, better health in general. Well, insoluble fibers, the one that can't digest dissolve in water, it's cellulose. Our body doesn't have the enzymes to break it down. It creates really good roughage or bulk for our feces. And that's really helpful too. But if you consume a lot of insoluble fibers when you haven't in a very long time, drinking enough water to will prevent constipation. And that's why a lot of carnivores, people who just eat purely like meats and like dairies, who don't consume enough vegetables and fibers, their gut microbiota is super different from people who do. Okay, these are other questions. What are the benefits of a plant-based diet? One is so much more fiber, which, like we talked about, is really good for your gut microbiota, good for your bowel movements, as well as all of the health benefits you get from it, such as decreasing risk of cardiovascular disease, hypertension, diabetes, certain forms of cancer, obesity. It also increases your longevity, intakes of magnesium, fiber, folate, vitamin E, calciums, and phytochemicals. Phytochemicals you cannot get in animal products either. So, what are the recommended dietary allowances for protein, lipids, and carbohydrates? If you guys go to the gym a lot, you probably might know the one for proteins, like how to calculate how much protein you would need in a day. 130 grams a day for carbohydrates, zero point 0.8 grams of protein per kilogram of body weight a day for protein. And there's no recommended dietary allowance for lipids because, like we mentioned before, it is not difficult to get fats, lipids in children. It's very tasty compared to like plants, I guess, or proteins, I guess. So kids tend to be okay eating fries covered with like fat, you know? How much calories do lipids, carbohydrates, and proteins offer per gram? 9 for lipids. Yep. What about carbohydrates? 4. And what about protein? Yeah, it's also 4. Okay, here's a fun one. What about alcohol? If you're a college student, you're taking this class, it's pretty good information to know how much calories alcohol gives you. I remember like reading a study about most of Americans' diet come from beer, like the caloric intake, and it makes a lot of sense because alcohol is 7 kcal per gram, which is more than carbohydrates and proteins, which is a lot. It makes sense why. Okay, is coconut oil long or short chain fatty acids? This is a trick question. It is medium. It's a mixture of both. It's solid at room temperature because it's more saturated than most plant-based oils. There's no double bonds though. It's absorbed more easily than butter because it has more medium chain than butter. And it's this is important information to know because there's like a lot of like things people do with coconut oil. Like I don't what is it called? Like when you put it in your mouth and they like replace it as mouthwash or something. I don't remember. But anyways, coconut oil, it's better for people who are underweight because it's super easily digestible and because it's a lipid. Um, so if there's people like it's recommended for people who have digestive problems, who want to gain weight, who are underweight, consuming a lot of coconut oil as a substitute to other oils can help. The last question, how does a heart attack occur? If you are a medical student, you probably hear like many variants of this question because it's a very common problem in America. So having the knowledge of how it occurs could hopefully prevent it in our own bodies. When blood flow to a part of the heart muscle is blocked. That is true. There's specific steps before that occurs. That's like very problematic last step when the blood clot forms there. So first, your blood vessel is damaged, and it's you can't really damage on a normal day-to-day basis. It has to be caused by something, typically from smoking, diabetes, hypertension, high, low density lipoprotein infection, extended chronic inflammatory response, so like a lot of cholesterol. So because of that, there could be like a little nick or a cut in your blood vessels. And then all of your white blood cells, your scavenger white blood cells, will quickly move to the site and engulf all of that oxidized low density lipoproteins from circulation. And as you can imagine, because it's like glaring and like eating it up, it's creating a bunch of plaque on the blood vessels wall. And as you imagine, if there's a lot of plaque, the blood vessel wall that's supposed to be this big starts getting smaller and smaller, which causes high blood pressure and then vasoconstriction. Like if you are playing with a garden hose and you put your thumb in front of it and it shoots out more powerfully, that's basically what's going on. And you don't want high blood pressure, or because when a blood clot comes along, it can't pass through. And then you have a heart attack if it's like in the heart. And then there's also one for like if the blood clot is in your brain area. So that's how a heart attack occurs. So preventing that by not doing all those things on the list or minimizing it, is important. So this is the end of the Jeopardy session. Please make sure your name and your email is in the chat so I could take attendance. And I'll be here for if anyone has any questions. But otherwise, good luck on your midterm.